Hi, my name is Mackenzie Williamson, and I did my internship at the UAMS Outpatient Therapy Clinic. The outpatient therapy clinic includes physical therapy, occupational therapy, and speech therapy. The clinic provides evidence-based outpatient therapy to patients with neurological disease, neck and back pain, injury, or amputations. Their therapy clinic is equipped with 2 exercise gyms, traction room, exam rooms, and they typically provide services to older patients, veterans, athletes, those with chronic conditions, or patients recovering from injury affecting mobility or speech. And below I have attached their address. My preceptor is Vito Villa. He is an occupational therapist at the outpatient clinic and specializes in adult care. As an OT, he treats injury and disabled patients through the therapeutic use of everyday activities. So some of the small internship projects that I did throughout my time at the outpatient therapy clinic was using Excel and organizing, collecting data. I would input data into Excel, and they usually used that information for research purposes or ways to improve their programs. And one of the other things was helping keep the areas clean and organized. So for my main project, I was tasked to help create and establish a community garden for the therapy patients to use. And this was also going to be a community space for everyone to enjoy and benefit from. So a lot of my project was researching the benefits of a community garden, and I found that they help establish more cohesive communities, and they are more than just a place for people to grow vegetables. They are a complex, multifactorial activity space for the community. Through some of my research, I found a study done in New York that found that community garden programs were useful in facilitating neighborhood development and showing more health promotions in the area. And these are a couple of my slides from my research. So most of my project was doing a lot of the research and finding more information from other researchers. And I found a lot of the benefits of the community garden. They really bring in the community and help people feel more inclusive, and they also promote a healthier lifestyle. Some of the goals and areas of responsibilities were research impact of community gardens, research health impacts on the community, educate community on the benefits and outcomes of a community garden, and my areas of responsibility based on the in-check competencies and subcompetencies were access existing information and data related to health, identify sources of secondary data related to health, extract data from existing databases. So for my second project, it actually consisted of 2 different tasks. My first one was reviewing and proofreading research articles. For this project, I was helping one of the professors within the physical therapy department with her research articles. I reviewed and checked for errors and formatted the articles. So for this, most of my work was formatting in-text citations, margin lines, article structure, checking for misspelling, and mispunctuation. She had 3 research articles that I reviewed. And the second part of my project was to help create data for new EEG software. I tested the EEG equipment that shows movement of the body as well as the pressure on the feet. This equipment is being tested to test the severity of concussions on the body. And by using this technology, we are researching the concussion severity and the impact that it has on body movement. And for this project, my goals were to provide excellent feedback on the research articles, improve the quality of the articles, test the EEG's equipment and collect data, fix and tweak the performance of the sensors, find the best way for patients to put on the sensors, and for my areas of responsibility, to collect and manage data, collect data based on the evaluation or research plan, use available technology to collect, monitor, and manage data, develop recommendations based on the findings. And so some of my experience from internship, I found professional work experience, I gained software and clerical experience, I networked with multiple professors and professionals, and research and collected data experience. And here were a few of the people that I worked closest with. Dolly Resch was the executive assistant in the physical therapy department. Elizabeth Garcia, who was a physical therapist assistant professor, and Dr. Nadia Marconi, who is also a physical therapy assistant professor. Thank you.